Hi, it's Dr. Winkler, Medical College of Georgia. I have Dr. Hanping Wu with me. We're going to do a TAVR and discuss the two cusps view and the septal length. But more important than that, Dr. Wu passed his boards. So we got a lot to celebrate today. Okay, so what we'll do first is switch to the TAVR workflow. Now we're getting, just so you know, Hanping, the intuition updated in a week. So here, I'm going to click on the aortic root. That was, I held down shift and left clicked. So it's extracting the aorta. Let's see how it does. Pretty good. And what we'll do is, as I like to do, we'll move over that so we get a calcium map. Move the white slider over, crank that up a little bit, and I don't like that it cut off that little bit, of the non-coronary cusp. So let's go here to region of interest, click this little green thingamajiggy so we know where we're at. I held down Alt and left clicked on the non-coronary sinus, and now I'm just going to draw that back in, being careful not to grow too far into adjacent structures. And since we're here, let's just grow the aorta a little bit more, because why not, now that I'm being fussy about it. Okay, so we'll do this, and full resolution, we'll switch from general to auto. We'll relax that a little bit. This is turning into a manual region of interest growing, but so what? Add select. Okay, so now that we've done that, I'm going to turn on our crosshairs and just trim it so it looks nice. You know, my rule has always been no ugly pictures. It's got to be pretty if it comes out of the lab. So here, I'm doing a freehand region of interest. I held down the shift key and placed all those dots, and now I'm going to just hit exclude. We'll come up here. See, when I hover down here near the F, or if you hover at the A, that circle appears. You can just rotate there, and now I'm using the arrow keys to turn it 90 degrees, and I'm just going to shift it back and forth. That would be a nice place to trim. And then again, I'm on the freehand region of interest. I'm holding down the shift key. I'm left clicking on the purple line, and that's going to make us a nice clean cut. See, looks pretty, right? Come back here for a sec. I'm going to just switch to bone so I can get that little piece of calcium a little bit better. Okay, so, and then maybe a little bit right there too. That's about as fussy as we should be. Okay, then again, we'll move that slider over and come down on that a little bit so we can see through it. There's a nice calcium map. It's a little bit fuzzy, so I'm just going to click this +1 here to expand it a little bit. Okay, so there's our root. Still not super happy. Let's just do this. Let's, yeah, there we go. Okay, so hit X. Gives you a good sense of where everything is, right? And we'll take a picture of that. And we'll click this little box with the cross in it to save our work. Okay, so back to our TAVR, workflow, TAVR, we'll hit measurement. Okay, and so now I'm just gonna, for their sake, for the listener's sake, we'll go through the whole thing. I'm holding down the Alt key, clicking in the aortic root, left clicking, then counterclockwise here in the coronal view. Don't have to do anything in the sagittal view. That gives us a pseudoaxial view up here in the left upper window. I'm going to, by holding down the middle and the right mouse button together, come down to where the right leaflet nadir is. Now it's a little bit blurry, so normally I use the right, but in this case I'm not happy. I see that the left is sharper, so in this particular case I'm going to hold down the Alt key and use the left as my first hinge point. Everything's a little bit blurry, but I see right here the leaflet material, right there the sinus material. I'm just going to keep scrolling down, positioning myself for where I think it's going to disappear, which is right here. However, when I check my other views, if you look here in the pseudosagittal, it actually looks like the hinge point is there. I think that's a fake out. I'm just translating through the pseudocoronal. It's there, isn't it, Hanping? Wouldn't you agree? Right there. Okay, so that's one. Now, to keep myself from getting too confused, since I'm using a different hinge point than usual, I'm going to continuously orient my views so that I'm looking at everything relative to the annulus itself. So the flow of blood is now going from inferior to superior on my screen. Now I'm going to rotate my axis up here in the pseudo-axial plane while I'm watching down here in what's a double oblique plane at this point for where the nadir of the non-coronary leaflet is. And it's about there, I would say. So I'm going to, in this case, have to give that a little bit of clockwise adjustment, and then I'm going to readjust our vantage point by hovering here and rotating the whole screen. That's 3 points are going to determine a plane. Now down here in the lower right screen, I'm holding down the middle mouse and the right mouse buttons together. The middle mouse button's the wheel, of course, and seeking that last hinge point by going back and forth, and I found it here. So I'm going to just do a little bit of adjustment, and so now we've got our annulus. So that's not the way I normally do it, but here's the take-home point. If it's blurry, if there's motion artifact, I like to start with the hinge point that's the sharpest, because I like to start at a spot that can lead me the best. Right? Does that make sense?
Yeah.
Okay. So now I'm clicking this little triangle over here, and that sets us up to lay down the hinge points. So right here where the green line's coming through, that'll be our left. Then up here where the purple line or mauve colored line is coming through, that's our right. And then over here on the green, that's our non. So that is more or less correct, then I'm going to click 3-cusp view here, and we'll take that picture, right? Now here's where I'm going to show you my manual way of getting that 2-cusp view. You know, in this view, the right is in the front. It's the closest to us. If there was truly an aortic root on the other side of the screen, the right cusp is pointing at us, right? It's the most anterior. So I'm just going to rotate. If we were looking from below, I'm rotating clockwise. And I'm going to just position the right hinge point over the left. Okay, I'm going to pause our recording here and take a call. So, one of the issues here is it turns the orientation of everything else. Did that affect? Yeah, we're not quite in plane anymore. But that's the gist of it. Let's take that picture. Right? I'm not quite lined up perfectly. Can we do any better? No. So you see here in the corner we've got it. It no longer looks like a perfect oval. It looks more like a, I don't know what, a guitar pick, a slug. I don't like it. You know, I like it when it looks perfect. So, you know, I'm going to go back and just quickly fix it. Oh, I was hitting the wrong key there. So anyway, there's our left, right? I mean, correct. And from there, yeah, I want to unlock it. There's our right, and translating back and forth. That should be our non. Okay. I'm not sure what's going on here. Oh, there we go. Not quite perfect. Oh, they weren't having it, those rascals? Well,
maybe it was in the wrong place. One resident came for a second, then he left. I wasn't sure.
Okay. Well, anyway, we're here doing a TAVR. Our medical student, Sean, just came in. No, don't worry about it. So anyway, we did the 3-cusp view, and now we'll hit annulus, and we'll measure the annulus there, just below. So I like doing this with the assisted distance pair tool. I think I clicked the wrong thing there. Assisted distance pair. Okay, right across. Perfect, right? And we're well above the 5.4. That's the cutoff between the 26 and the 29. And there's really no LVOT calcification here. This one's good for a sapien valve. So we'll click on that. Let's see how we're doing over here. I don't need that picture. So I'm just right-clicking to delete those ones I took in error. That's good. Save our work here. Okay. So now I'll show how I'm doing the septal length. So the membranous septum is kind of over here. Here's the interatrial septum. So the membranous septum has to be around here somewhere. So I just held down Alt and clicked, And now I'm going to rotate back and forth, and in this particular instance, it's really long. I can see down to here. Well, there's some blurring, but there's fat coming all the way up between the right atrium and the right ventricle. And there's plenty of length here. So I guess you'd measure it down to there. That's unusually long. So it's from the annular plane, and we're going to measure down to where we think it starts. So 11 is long. That means that you could go even longer than that in depth, but why would you? So we'll take that picture. All right. I'm going to hold down Alt and localize ourselves to the center of the annulus, and then I'm just going to rotate the axis there until we see the coronary ostia, and drop a line for the coronary heart height. I'm hitting D to get these calibers. And then also here, I'm going to just measure the distance between the sinotubular junction, STJ, and the annulus. Now, that distance is different, at the site of the right coronary cusp. Right here it's much higher. See that? So the sinotubular junction plane is often skew to the annular plane. Like here, for example, it looks really long, and that's because the distance between the two is usually the greatest near the non-coronary cusp. Okay, so what else do we need to do? We need to measure the right coronary height. That's over here. I'm hitting D, left mouse hold and pulling down to and let's just make sure we've got that nice and vertical down to the annular plane. Okay, capture with the C key. So now I'm just going to translate this up. We're going to measure where the sinuses of Valsalva are the widest. Now, often that's just below the commissures, which are the highest portion of the valve in the superior part of the interleaflet triangles. But in this particular case, it's pretty much at the site of the commissures. And the way we measure this, well, the way we report it is the left first, and then the right one, and then the non-coronary one. And for whatever reason, well, I know the reason, it's my obsessive compulsiveness. I like these lines to cross in the middle. And again, that's just so it looks neat. We'll take a picture of that. Alrighty, and then we'll just continue up here, and this measurement doesn't have to be as critical. That's the sinotubular junction measurement. Well, in this case, I'm going to use the assisted distance pair tool. And what we'll do is we'll give them the area-based average diameter, which, sees the circumference, sees the area and works backward to double the radius. All right. Now, I'm going to save our work here and come back. Oh, shouldn't have done that because that violated the HIPAA. Now, what do we do to fix that? Well, I'll give it to Sean here. He's a programmer. Maybe he'll figure out how to edit it. Okay. Even if it's for an instant, it's it has to be edited out. Okay, so I'm going to hit reset here, which is what I meant to do, and then I'm going to hold down Alt, click here in the center of the ascending aorta, do a double oblique, make sure we're around and about the middle of the right pulmonary artery, and we'll use the distance pair tool again. Assisted distance pair is what I wanted to use. Assisted, it's Alt-D. There's a shortcut. I should start using that. Okay, 38. And then there's one more measurement here before we score the valve, which is just to translate back and forth through here and do the aortoventricular angle, which is not really an angle between the midline of the ventricle and the midline of the aorta. It's standardized. You do it in this coronal view, and it's this distance, which is it really should be the opposite of that. Right. Somehow I got that to the wrong way. Yep. That's another TAVR. Alrighty.